Hi my beauties, my name is Dr. Stefani Kappel and I'm a board certified fellowship trained cosmetic dermatologist in Newport Beach, California. And today I'm doing a video from Hawaii on vacation with my family. So I literally just snuck into like the closet area because I wanted to find a quiet place where I could just post this video because my kids are running around, and I want to be consistent with my YouTube videos each and every week. So here we are, and today I'm going to be talking about RF microneedling versus microcoring because a lot of you guys have asked me to do this topic, and now with Ellacor and microcoring gaining a lot of popularity, and now that we're treating patients in the office and seeing such amazing results, I feel like a lot of people are having some confusion regarding the difference between microcoring and microneedling. So I'm going to do that video topic today, and before I move on, I ask that you like and subscribe and share this channel with anyone who may find it useful or anyone who wants non-sponsored content. So I feel like I'm a rarity on YouTube these days because my content is all non-sponsored. I've never accepted paid partnerships. You'll never see coupon codes, and I've practiced this way since the moment I graduated and finished my education, residency, and fellowship training, because I feel it's really important to maintain authenticity and just promote and recommend treatments and devices that I feel give my patients the best outcomes, not because a company's paying me to do so. So if you want non-sponsored content, I'm true to that. I've been true to that my entire career, and I'm not stopping now. And I feel that anyone else who appreciates that will find this channel useful because it's just based on years of education and training, having access and sneak peeks to different devices, lasers, skincare products, all the things in cosmetic dermatology without the bias of being in a paid partnership with a company to not be able to post other treatments that may be good, or having to say something works when it really doesn't, or when it's not the recommended treatment for our patients. So I'm true to that. I will always stay true to that. And I really appreciate your support because the only way to grow because of that is by word of mouth and just sharing this channel. So I really appreciate you guys. And without further ado, we'll take a deep dive into the difference between microcoring and microneedling. So if you guys haven't seen my previous videos on microcoring or the device is called Ellacor, I encourage you to watch those videos. And my experience with this device was back in 2017. I just finished my research fellowship and I was participating in clinical trials, which was a really amazing experience for me as a cosmetic and dermatologist, a cosmetic and fellowship trained procedural dermatologist, because I had access to many devices. And you know, it was a 2-story building with like 30 rooms with over 100 lasers and devices. And a lot of these devices that are now new on the market, I had access to way back then and just had experience with them in clinical trials, and Ellacor is one of them, and one that I was really excited to wait for its FDA approval because I was so impressed with the results that we got treating hundreds of patients in clinical trials. But it takes about 5 to 6 years, if you guys don't know this, for a device, especially like a laser or a skin tightening device, to gain FDA approval. So Ellacor was recently launched back in October 2022, and my colleagues, well-esteemed colleagues from Harvard, Mass General, Wellman Labs, and people who trained me and the fellows that came before me in my training program, which was a really coveted training program with the world's most renowned laser experts and device experts, I was really happy to hear that they were getting great results and they encouraged me to get this device. Now, if those people encouraged me to get a device, and when I'm hearing, you know, the people at the podium at academic meetings showing their before and afters, that really incentivized me to get the Ellacor device. Now, when I received it, when I purchased it, I rolled it out very slowly. I treated one of my closest, dearest friends because I wanted to see a very close follow-up with her, see how she did, and post her before and afters. And since then, we've treated just a handful of patients because I'm rolling it out really slowly, because although I was very impressed with the device way back when, sometimes if the company changed something in the handpiece or the device, or something has been changed, I didn't want to get too excited because what if I didn't like it as much as I did before? And it's even better. I can't say enough about it. And Ellacor microcoring is an amazing skin tightening, new revolutionary technology. If you want to hear more about Ellacor in and of itself, you can watch my previous videos, but I am very honest and authentic, and you can see the progression in my videos where I came back from a conference and I'm like, I'm excited about this. I loved it years ago, but let's just see. I'm very hesitant. Let's see how it goes. And then we treated our first patient, and I was excited about those results, but just still very guarded in my opinion of it. And now I'm really excited about it. And I'm really excited to share with you guys more before and afters as we have more patients having a longer treatment, post-treatment duration, which we can post a 1 month, a 3 month, and you know, a 9 month before and after photo if people give me consent to the the consent to do so I can share with you guys too. So that's Ellacor, that's microcoring, but I wanted to dedicate this video talking about the difference between microcoring and microneedling because that comes up a lot. So microcoring, which is Ellacor, is hollow needles that punch out little columns of skin. You're basically taking out skin and it's attached to a vacuum and it basically sucks it out. It sounds horrible, and even watching the videos, it can kind of look scary, but it's a really elegantly engineered device. It was actually engineered by Dr. Rox Anderson, who is the brains behind Fraxel, pulse dye laser. He was one of the first to discover laser tattoo removal, laser hair removal. I mean, he's a god in the dermatology world. As a matter of fact, I say this all the time, but when I met him during a Harvard interview, I was completely speechless because this gentleman's mind is amazing. And the fact that Ellacor and microcoring was a technology that came from his brain makes it just, a slam dunk for all dermatologists who know and understand cosmetic dermatology. He's a well-respected giant in the field of dermatology and has contributed immensely to our specialty and to all of the devices and lasers that we see used in clinics every day. So the fact that Dr. Austin and Dr. Rox Anderson engineered this device in and of itself just gives this device a lot of credibility, and you know that if it's coming from Rox's brain, it's going to be a slam dunk device. So before I move on I just kind of wanted to give you the background of Ellacor and microcoring. Moving back to its comparison to microneedling. Microneedling is just basically needles, solid needles that are poking holes in the skin to elicit a textural change, collagen stimulation, breakdown of scar tissue, and some of the things that microneedling are said to promote in the skin. Now, in actuality, I don't have a microneedling device, and those of you who know me and follow me, you kind of know why. Again, I'm non-sponsored content, so I can say anything I want about any company, which makes it really amazing. Honestly, even if I bought the Ellacor device and I bought it, I didn't let them give it to me because I wanted to be able to say something negative about it if I didn't like it for you guys, because if it wasn't a good device or wasn't giving us the treatments and the results that we had hoped it would, I wanted to be able to say, you know what, I had high hopes for this device. I don't like the way it's working. I don't think it's giving my patients the outcomes that we were hoping for, and I want to give it back, and I want to be able to speak freely about that on social media. That's the kind of doctor that I am, and I'm true to that. So that said, I'm not in contract, not in sponsorship with Ellacor, with microneedling, nor was I ever with microcoring or microneedling. So when microneedling first became when it was FDA approved, this was back when I was still a fellow, I actually was really excited about microneedling, and we had a Profound, we had a Vivace, we had a Infini. That was before MORPHEUS8, and the results were just suboptimal. Patients weren't really happy with their long-term results. Yes, you get a little immediate inflammation and swelling that makes things temporarily look better, but when you look under the microscope at skin biopsies and when you look at clinical photos of before or afters with just microneedling alone, it's really underwhelming. There's really not that much difference. Microcoring is definitely a substantial difference. Now, to get that substantial difference in outcomes, that comes at the price of more downtime, more discomfort if you're not numbed, but with numbing you don't feel either one of them, and a little bit more invasiveness, because you can't compare microcoring, where you actually excising pieces of skin out, to microneedling, where you're just punching holes in it. They're going to give two different results. Obviously, when you're doing microcoring with hollow needles attached to a vacuum sucking columns of skin out, you're essentially shrink wrapping the skin, because you can change the settings on the Ellacor device to 5%, 8%, even 10% of the skin being removed. And now if 10% of your skin's removed, that's like if you have a facelift and they excise the skin here and they pull it back, minus that horrific scar that you get. Ellacor is going to remove that same amount of tissue and skin, but without that huge scar. It's not going to be in a linear incision site. It's going to be in these tiny little microcores that are less than 500 micrometers, and it's going to give a scarless facelift essentially, because you're removing 10% of your skin's gone, so it has to tighten, right? Microneedling, none of the skin is excised, none of the skin is gone, so you're not going to get that substantial of a result. Another difference is, between microcoring and microneedling, microcoring has no dissipation of heat and there's no energy. It's a purely mechanical dermatologic skin excision. There's no RF, there's no ultrasound, there's no heat. And what that means is that there's less risk of hyperpigmentation, although it's only indicated for skin types 1 through 4. I'm going to probably play around with it with some of my darker skin tones because that's my area of expertise, doing devices and lasers and skin of color, but we're going to go very slowly and do test spots and play with it a little bit because I want everything to be accessible to all skin types. But microneedling, because there is RF or heat in the microneedles, it can stimulate post-inflammatory hyperpigmentation. It stimulates and enhances the melanocytes, which are the pigment-producing cells in our skin, to make melanin and can cause hyperpigmentation. And that's another reason why I'm not a big microneedling fan. Patients who have microneedling at other medi spas and other offices will come back with horrific post-inflammatory hyperpigmentation, scarring, less than desirable outcomes. But I would say mainly the hyperpigmentation and scarring from microneedling is one of the biggest things that I have to reverse from other providers doing microneedling on patients with hyperpigmentation as a side effect. And we have to use lasers, and we have to reverse it with hydroquinone and different bleaching agents and various lasers. And it's like, by the time that they reverse the hyperpigmentation, you know, they might as well not have had the microneedling in the first place. So that's kind of the difference between microcoring and RF microneedling as well. There's no dissipation of heat, which decreases dramatically the risk of post-inflammatory hyperpigmentation or any type of pigmentary alteration, even hypopigmentation or depigmentation, which can be even more concerning. And because there's no dissipation of heat with microcoring, there is a less of risk, or almost, I don't want to say zero risk, because I always think that that's, you know, that's something that I can't say for sure, but there is dramatically a decreased risk of fat atrophy or melting the fat. And physiologically speaking, I don't think that you could have any melting of the fat or fat atrophy with microcoring. You know, you never want to say never, but it was never documented in the hundreds of cases in the clinical trials, and it hasn't been documented yet to date. So I think it's safe to say it doesn't cause any damage to the subcutaneous fat, which can otherwise make us look like we've had volume loss. RF microneedling, you know, when it's too high or when the heat's too much, it can cause some fat atrophy as well. So the other difference between microcoring and microneedling, to my knowledge and what I've been told, is that microcoring should only be performed by a physician or an MD. I don't think that that's going to probably hold true long term, but it is considered a type of dermatologic surgery. But the good thing is that anyone doing microcoring has to have a higher level of expertise, because in the wrong hands, it can, you know, cause some bad side effects. On the flip side, in the hands of a skilled provider, it can give next level results. And to be able to operate and perform this device safely and effectively by a highly trained provider will give next level results that are not comparable to microneedling, which are always, in my opinion, suboptimal. And on that note, because microneedling can be performed in some states by estheticians, people that don't have that, you know, that level of training, they haven't gone to medical school, they haven't done an internal medicine year of internship, they haven't done 4 years of residency, they haven't done a fellowship. I mean, you can't compare the level of training from someone who's performing RF microneedling to that of someone who's performing Ellacor. From what I've been told, which is actually a good thing, because that's going to help protect patients. With a higher level of, you know, aggressiveness of a treatment comes higher level results, but can also have higher level of complications if it's not performed correctly. So when it comes for candidates for microcoring versus microneedling, I would say 10 out of 10 times microcoring is absolutely better for my more mature beauties, because it is such a more substantial outcome. For my beauties who always, you know, do this, I always say this is the perfect treatment for the people who do this. They want to kind of raise their skin up, tuck it up about a centimeter or 2 centimeters. Those are the patients who do well with microcoring. Microneedling is not going to really make a difference. It's not going to have a significant impact on someone with that much laxity, or for my more mature beauties. So for older patients, I feel that microcoring is a definite yes. For my younger patients who are trying to be more preventative, maybe microneedling is a better option for you, because you're not going to get that much of a result. You really don't have much to lift or tighten or pull, because you don't have that much laxity yet. If you have acne scars, you know, I do believe that RF microneedling can be useful, but again, I'm not sure if it's worth the risk of hyperpigmentation, and I'm not sure if the improvement in acne scars is just from the post-treatment inflammation that goes away 3 months later, because all the before and afters I've seen in, you know, online and their trials and in real life, at 6 months, the results are gone. At 12 months, they're totally gone. Whereas lasers and other devices, and especially Ellacor, those results are going to last probably forever, or, you know, at least 5 to 10 years. The patients that I treated, you know, 5 to 6 years ago are still maintaining the results. So the long-term duration of your results is definitely more significant with microcoring versus microneedling. Getting back to the perfect patient candidate for microcoring versus microneedling, to recap, microcoring is better for more mature skin or people who have a significant laxity that really need an overhaul, that really need a significant result. Microneedling is for somebody younger who just wants to kind of dabble in aesthetics and get like a fun treatment that may not do that much, but if it doesn't, that's okay. That's my interpretation of microcoring versus microneedling. To recap the things that we've talked about so far, microcoring is excising skin. Microneedling is not excising skin. Microcoring has the hollow needles with a vacuum that sucks the skin out. And microneedling doesn't have any skin excision capability at all. Microcoring has no dissipation of heat or RF energy. RF microneedling has RF and heat that can also lead to post-inflammatory hyperpigmentation and fat atrophy. Microcoring is better for people who need a more significant result, my more mature patients. Microneedling may be better for people who are younger and just want a little, pre-rejuvenation treatment that may or may not work, but you're not going to be upset if it doesn't work that well. You're not looking for some significant results. And again, the provider that is going to be performing microcoring, I've heard it should be only an MD, although I'm sure as it gains more popularity, more and more people are going to be adopting this treatment, and they may be a little bit more lenient with the qualifications needed for a provider to perform Ellacor. But for right now, it's usually a higher skilled provider versus RF microneedling. You can find these on every street corner, a dime a dozen. There really isn't any regulation in some states with the qualifications needed to perform RF microneedling. I think estheticians in some states can perform this. And again, not to say anything negative about an esthetician, but you can't compare the knowledge base and the level of training of an esthetician to somebody who's been through 4 years of medical school, a whole year of residency, internal medicine internship or surgical internship, 4 years of residency, and a postgraduate fellowship and research year, most of us have too. So it's just a different level of training, a different caliber of skill, a different level of treatment. And, usually with more downtime, more discomfort, although with microneedling and microcoring, hopefully you don't feel either one of them because you're using numbing injections and a numbing cream, nerve blocks, things of that nature. It would be more uncomfortable if you were to have microcoring because it's more invasive. But with more downtime and a more level of aggression of a treatment, the better the outcomes. Of course, the more significant the results. Look at the results of a facelift versus the results of like a Clear and Brilliant. Clear and Brilliant laser is easy peasy, no pain, no downtime, but a facelift, you're going to have significant downtime. You're going to be out for a while, but the results are definitely next level, and there's no comparison between the two. And I love a Clear and Brilliant all day long, but it's not a facelift. So I feel like, with the expected outcome and with the desirable outcome that you're looking for, if you're willing to put in your time for the downtime and what it takes to get that result, it's definitely worth it. But that's something that you should consider. If you want more substantial results, Ellacor and microcoring is definitely a better option than microneedling with or without RF. However, with that comes more downtime and more risk and a higher level of provider performing this procedure. Now, the last thing I want to say, and this is something that's said for both microcoring and microneedling. I've heard plastic surgeons say that if you want to have a facelift in the future, that you shouldn't do any of these treatments. And that's just not true. And I can speak as a dermatologic surgeon who does flaps and grafts and transposes skin. And as a Mohs surgeon, I have a lot of experience doing surgical procedures on people who have had these procedures. Thermage, Ellacor, microneedling, even Fraxel or fully ablative CO2 resurfacing devices. What these devices do that are non-surgical or enhance collagen stimulation. Now, in a sense, that's considered scarring because a scar is a response to trauma with synthesis of collagen, usually forming a hypertrophic scar or a keloid. In these cases where we're doing these non-surgical procedures, yes, you're enhancing scar formation, but scar formation is unanimous with collagen production, right? But the way that Ellacor and microcoring is performed in the skin, it's less than 500 microns of skin that's excised in a scarless fashion. So if any plastic surgeon says that it's causing scar tissue that will prevent you from having a surgery in the future, is either misinformed or just wants to get you in the OR because they'd rather operate on you and have you pay a lot more money than doing a minimally invasive procedure that may buy you time until you need a facelift. Or if somebody doesn't ever want to have surgery, it's the perfect solution for somebody who wants to avoid going under the knife and just have a minimally invasive procedure. But should you change your mind later and want to have a facelift or a neck lift or any type of surgery on the face, it's not going to make you a less than desirable surgical candidate. And again, I speak to you and tell you that as a non-sponsored physician, which there's very few of us out there. I'm not trying to get you in to do one treatment or another, and I'm just trying to give you honest authenticity and honesty, and can speak again as a minimally invasive non-surgical cosmetic dermatologist and as a Mohs micrographic surgeon and a dermatologic surgeon. So I wear both hats, so I can speak on both sides. So don't worry about microcoring or even microneedling, since we're talking about microneedling, be causing scar tissue that will prevent you from having a surgery in the future. And I've done videos on this in the past, and just wanted to revisit. Although I'm not a huge microneedling fan, it's only because, you know, I'm all open for new technologies. When microneedling first came out, I was super excited. Like I said, we had a Vivace, a Profound, and Infinity before MORPHEUS8 was available, and I was so excited for this new technology. And then when we saw the patients were upset and got less than desirable outcomes, and then they had hyperpigmentation, when we had the other laser rooms going with like Fraxel, Halo, Clear and Brilliant, fully ablative CO2, Fraxel Restore, Fraxel Repair, I mean, there's no comparison. So my provider, or my fellowship director, who's a world-renowned laser expert, would be like, get this RF device out of here, like, or get this RF microneedling device out of here. And I was like, whoa, okay, so I guess that's not a good option. So, you know, you're a product of your experiences. And again, I can speak freely about this because I'm not sponsored by anybody. I also don't want to hurt a company's business or their device. So it puts me in a hard position, because although I don't want to say anything negative about a procedure or device, I also have an ethical devotion and, a vow to protect patients and just protect you guys from falling for false advertising or false marketing. Because let's be honest, you're going to see a MORPHEUS8, you see it all over the place. Now, why do you see it all over the place if it doesn't work that well, in my opinion? There's $75 million of marketing that went into MORPHEUS8. They come to my office all the time trying to get me to buy the device, and they show me these before and afters, and it's always MORPHEUS8 plus liposuction of the arms, or MORPHEUS8 with a Fraxel, or MORPHEUS8 with skin tightening with Thermage, or MORPHEUS8 with something else. And it's never long-term before and afters. It's always maybe like 3 weeks later when they're still inflamed or when they're still swollen, so either acne scars or wrinkles look better. But I can never get them to show me long-term data, histological stains, histological skin biopsies at baseline compared to 6 months, compared to 1 year. Because if you are to compare a before and after of baseline and Ellacor 6 months later and 1 year later, those results are dramatic and they're amazing, and they get better with time. Microneedling, microneedling MORPHEUS8, 1 year later, you're gonna look 1 year older, and that's not my impression of like a good device or a good treatment. Also, you know, you're a product of your experiences, and I see a lot of people coming into my office with hyperpigmentation, less than desirable outcomes, you know, unhappy patients, scarring, infection, and not being very happy with the money that they had to spend and the amount of treatments that they had to have with MORPHEUS8. And so that's why I don't have that device in my office. Again, I don't want to say anything negative about the company, but I'm very unimpressed. Now, why do you see them everywhere? Because someone who has maybe my level of education and knowledge is going to know the difference between a MORPHEUS8 and like a Fraxel. I'm not going to buy a MORPHEUS8. I'm only going to have all of the devices that I have in my office have stood the test of time and have proven time and time again to be the best treatments available for right now at this date and time. And somebody who may not have the education and training, say that they're board certified, but they're board certified in OBGYN, they open a medi-spa, because let's just be honest, there's very few of us board certified dermatologists out there. It's a very competitive specialty, and people are saying that they're board certified in dermatology, but they're board certified in another specialty practicing cosmetics, you know, because anybody could do Botox and everybody could do fillers or have a microneedling or have a IPL in their office, a bunch of extenders, and then go to, you know, vacation in Florida and have this medi-spa running and operating by a bunch of extenders using drop-down menus. I mean, you're just not going to get the results that you are in a higher caliber office with higher caliber devices with operators who are highly trained. So that's kind of my little small niche, and I'm a rarity actually. So you're going to see more of the MORPHEUS8s out there on, you know, a lot of different medi-spas, but that's not to say it's better. That's why you see more of it out there. They even came to my office and they're like, we just put, you know, $75 million into our marketing. We have the Kardashians backing it up. Why don't you have this device in your office? And I'm like, because I don't feel like it works that well. And they're just like, well, the marketing's going to, you know, carry it. And I'm just like, oh my gosh, and I even feel bad, I may not even put this on my YouTube video, but I also want to be honest, because there's such a you know, a discrepancy between me being authentic and protecting you guys and giving you the truth, but also I don't want to say anything negative about a company or a device. But when you see a lot of hype and marketing about MORPHEUS8, and then now you're going to see Ellacor and Microcoring, I just wanted to do this video to kind of distinguish the two, but then to also give you the advice to just cite your source and know that just because a treatment, for example, MORPHEUS8 is shown everywhere, that doesn't mean it's better. It just means it has great marketing and a lot of people behind it and a lot of people buying the device and trying it to market it to their patients, but they may not have purchased the device because they know any better. They may have just, you know, known the ROI is good and, you know, a lot of people are getting it and the Kardashians are backing it up. So it would be a good, worth it, you know, device to incorporate into their practice. So that's kind of my take home message. Again, I'm just, here to provide you with honest information. Drop a comment in the comment section, and if you've had a great response to microneedling, let me know, or Morpheus, let me know. I'd be happy to hear it. But from my perspective, all I see is negative complications and unhappy patients from it that I have to reverse their complications and give them treatments that actually work. And then they're happy, and then they're like, oh, they have their aha moment. And then seeing more data and more information out there about Ellacor and microcoring, I think you guys will see with the test of time that microcoring and Ellacor is definitely next level, definitely better results. But again, with better results comes more downtime. With microcoring, you have like the little post-treatment erythema where it's in the shape of the squares demarcated from like the handpiece. That usually lasts 1 week, but we're seeing it last even more in some patients. But the good news is that it's easily reversible, and people who have the prolonged erythema or the little red squares that last a little bit longer with microcoring that you don't get with microneedling. So that's another difference between the two. You don't get those like squares with microneedling that you get with microcoring, but they're easily reversible with V-beam laser. Actually, my dearest friend who actually posted her own YouTube experience of Ellacor and microcoring, her squares lasted a little bit longer. She was also on a lot of blood thinners and bled a lot during the treatment, so I probably will have all my patients stop their supplements and their blood thinners. But you know, I didn't want her to have to stop her supplements because it's like, you know, the fish oil, flaxseed oil, multivitamins, and a lot of supplements that are good for your body and good for your skin can thin the blood and make you bleed more. And we're seeing that that can cause a little bit more prolonged post-treatment erythema with the squares. But again, they're easily reversible with V-beam laser, which dramatically fades them as well. So the patients that we've treated so far with Ellacor are doing really great. Some of them haven't had the red squares last for longer than a week. And those who have at 4 months, if they're still there, we V-beam them and they usually disappear. So stay tuned for my before and afters because I'm going to be posting those soon. And also, I really appreciate my patients and my beauties out there who let me post their before and afters, because people don't always, we'll have a beautiful before and after and people are like, I don't want to remember and post what I look like before. And I totally get that. And I have to protect patient confidentiality. So just keep that in mind too. More information coming your way. And again, share this channel with anyone who finds value, and hopefully they do, in non-sponsored content from a fellowship trained cosmetic dermatologist who's board certified in dermatology. All right, you guys, aloha and mahalo.